This is everything that you need to know about Nimbus, the new COVID-19 variant. India is the latest country to report a surge in COVID-19. India is the latest country to report a surge in new COVID cases as the latest variant NB1.8.1, or some have nicknamed it Nimbus, spreads across the globe. Cases have now been reported in Asian countries such as Thailand, Indonesia and China, while the UK Health Security Agency recorded the first 13 cases in England last week, but the true numbers are unlikely to be known, given the significant decrease in the number of people testing compared to the figures seen during the global pandemic 5 years ago. What we know about Nimbus, or NB1.8.1, is that it stemmed from the Omicron variant and was first detected in January this year, 2025. It quickly spread, as in really fast, across China and Hong Kong and has now been recorded in several states across the United States and Australia. In April, Nimbus comprised about 10.7% of the submitted sequences globally, according to the World Health Organization. This rose from 2.5% a month before. So, the WHO declared the NB1.8.1 strain, or Nimbus, as a variant under monitoring on 23rd of May, which means scientists believe it could potentially affect the behaviour of the virus. They suspect that the surge is due to the fact that NB1.8.1, or Nimbus, it spreads more easily than the other variants. They suspect it may infect cells more efficiently than the earlier strains. Dr. Chun Tang is a GP at a UK private healthcare centre. He said that the NB1.8.1 isn't too different from the Omicron variant, but it does have some tweaks to its spike protein, which might make it spread a bit more easily or slip past some of our existing immunity. That said, early signs suggest it doesn't seem to cause more serious illness, but of course we're still learning about it. The WHO assesses the additional risk to the global public as currently as low. It's lowered. And existing COVID-19 vaccines are considered effective in preventing severe disease. However, the Nimbus variant, as it has been dubbed, does appear to be more transmissible than the previous strains, with notable increases reported in India and Hong Kong. The common symptoms of Nimbus include a severe sore throat, a razor blade throat, I've heard it referred to, fatigue, mild cough, fever, muscle aches, and congestion. But you can find all up-to-date information on the Gov website, the WHO website, and the UK Health Security Agency. So it's the UK HSA. They'll have information on their websites too. Stay safe and stay informed.